My name is Arlen Zamula. I work for the New York City Department of Health and Mental Hygiene. I'm actually the Health Equity Capacity Building Director in the Harlem Bureau of Neighborhood Health. Community engagement really needs to be the keystone of any project. It's also really important to be authentic. And what I mean by that, it's important to listen, to empathize, to be clear about your intentions and your limitations. You need to be honest and you need to build relationships. If you want to work with the community, you need to be part of the community. So it really needs to be the beginning, middle, and end of any project. Community engagement is not a one-time thing. It's not a, hey, we're going to drop in for an annual survey, or hey, we're going to do this random town hall to get your feelings. Real community engagement is a process that involves a lot of sweat equity. You got to build trust. You have to build relationships, and you have to build a mutual understanding that hopefully leads towards a more collaborative process and sustainable outcome. So for example, when we built out our El Barrio Bikes collaboration, we were gung ho, and the community told us, hey, you aren't listening to us. And we went on a really great listening tour. And the really important thing is we reported back to them. We built a relationship. We admitted when we made a mistake, and we really cemented our relationship. The community doesn't see it as an outsider, but as part of the community. Even when the health department had to take a step back and respond to COVID, the work continued because the community was the one leading the work. The Harlem team has spent years, if not decades, building relationships with our participants, our residents. And I feel like that trust and those relationships have allowed us to become a trusted source. That is not something that can happen overnight. That is something that takes a lot of time and a lot of effort to cultivate those relationships. And it allowed us to connect with people at the most important and vulnerable time. It has made us stronger in this kind of crisis because we're able to reach people that maybe we couldn't have if we didn't have those relationships. I think what we're really also trying to do is empower and employ local, taking that community engagement to the next step to build capacity. So how can we employ local to be coordinators? How can we employ residents and organizations to lead the work? How does community engagement lead to deeper capacity building for the neighborhood? If everybody wants the payoff, but at that work, you need to get to the payoff where you see the benefits of it. And we really want to utilize different tools that they're not only evidence-based, but community-based. So I highly recommend the Community Engagement Almanac. Has a wonderful breadth of tools and different activities depending upon the engagement that you're doing. Health and Action Toolkit has a great example of doing participatory work within the community. Also, the health department has a wonderful community engagement framework that helps ground the work. So community engagement is paramount. It is probably the most important step of any project that you're doing.